Let's look at the structures found in the upper respiratory tract. So here's a drawing of the upper respiratory tract, including the nose and the throat, or pharynx. As you notice, the portion of the nasal cavity that is seen or viewable from the outside is called the external nose. Your external nose is made up of primarily cartilage and skin. The internal nose, which is this cavity located here, its function is to, one, filter air that enters the respiratory tract using mucus, hair, and cilia. It warms the air. There's a lot of surface area, and this surface area is warm due to blood flow to the mucous membrane. So as air travels through the nasal cavity, it is warmed. It adds water vapor to the air, so it humidifies the air. It contains your olfactory epithelium for your sense of smell, and it resonates sound during speech. So notice the olfactory epithelium is only located in this upper part of the nasal cavity, the superior region here. This is where your olfactory neurons are located that can pick up and detect certain chemicals that you breathe in. The surface area of the nasal cavity is increased using the nasal concha or turbinates. These are these processes that stick out into the nasal cavity. The spaces in between are kind of like tunnels or tube-like passageways known as meates or meatus. Located surrounding the nasal cavity are the paranasal sinuses. Your frontal bone has a sinus. Your sphenoid bone has a sinus, or sinuses actually. Your ethmoid bone has sinuses, not shown. So do your maxillary bones, not shown. But these paranasal sinuses are air-filled cavities lined with mucous membranes, very similar to the mucous membranes of the nasal cavity. The tonsils are located strategically where incoming air or food can enter, and that air as well as food may contain microbes that attempt to penetrate into the body. This tonsil here is known as the pharyngeal tonsil or adenoid. There are two palatine tonsils on each side of the soft palate, and there is a pair of lingual tonsils at the base of the tongue. This would be known as your hard palate, made up of bone. This is your soft palate, made up of soft tissue. And this part of that soft palate is known as the uvula. Your throat contains three regions, shown in this small picture here. The yellow shaded region is known as the nasopharynx. It's going to receive air that enters from the nasal cavity. Inside that nasopharynx is the eustachian tube, the opening of both eustachian tubes. There's two. Recall the eustachian tube extends to the middle ear and equalizes pressure on each side of the tympanic membrane, the eardrum. This is also a site where infection from the upper respiratory tract could travel to the middle ear and cause a middle ear infection, or otitis media. The oropharynx is located behind or posterior to the oral cavity. Note that the oropharynx can either get air from the nasopharynx or through the mouth. So air can enter your respiratory tract either through the nasal cavity or through the oral cavity. And either way, it enters the oropharynx. Then laryngopharynx is this region here of your throat. and then air will go into your larynx. If we are ingesting food or drink, that food or drink will need to go into the esophagus, located behind the larynx and trachea. So in order to prevent that food or drink from going down the respiratory tract, there is an epiglottis located right here. That epiglottis prevents food and drink from going down the respiratory tract. Notice the larynx, technically part of the lower respiratory tract, will contain the vocal folds, which we'll look at more closely on the next slide, protected by a lot of cartilage. There's a lot of cartilage in the respiratory tract that we will be looking at, and that allows the respiratory tract to not only be protected, but also stay open, as air is almost always either going down to the lungs or coming back out from the lungs. Here's a picture of the larynx, or voice box. A lot of the soft tissue has been removed, so this is focusing more on the cartilages that form the larynx, the bone known as the hyoid bone, which helps keep the larynx kind of open and prevent it from collapsing. This also does show two types of glands, the thyroid gland and parathyroid glands. You'll notice that this view here is an anterior view. This view here is a posterior view. As you will see, the anterior view, you can see the hyoid bone. And from that hyoid bone to this cartilage is a membrane that helps attach the larynx to the hyoid bone. Here we notice the thyroid gland, the large kind of butterfly-shaped thyroid gland. Embedded inside the thyroid gland are the 4 smaller parathyroid glands. The epiglottis has cartilage in it. It has quite a bit of elastic cartilage to help it be flexible in order to close off the airway during swallowing. The largest cartilage of the larynx is known as the thyroid cartilage. Quite often we reference that as your Adam's apple. The cricoid cartilage is the only cartilage that completely surrounds the lumen of the respiratory tract. You'll notice that the thyroid cartilage is more anterior. The cricoid cartilage is anterior as well as posterior, so it completely surrounds that lumen. There are some smaller cartilages found making up the larynx as well. The corniculate cartilage, the arytenoid cartilage, and there's another pair known as the cuneiform cartilage, which we'll see on the next picture. So a lot of little pieces of cartilage form that larynx. We have to look inside the larynx to note the vocal cords. So this is a mid-sagittal section through the larynx. We can see a lot of the same structures, the epiglottis. Here is that third small pair of little cartilages known as the cuneiform cartilage. It's a small little wedge-shaped piece of cartilage. The corniculate cartilage and the arytenoid cartilage. Cricoid cartilage, as well as the thyroid cartilage. Moving down from the larynx would be the trachea. So these pieces of cartilage are found in the trachea. The trachea has kind of C-shaped cartilages that don't completely surround the lumen. They're more opened in the back or posterior. Note inside the larynx are the 2 vocal folds, and we'll see why they're called vocal folds in a moment. But there's 2 pairs. The upper or superior vocal fold is called the false vocal cord because it does not vibrate. It does not produce sound. It's also known as the vestibular fold. Below that fold is the true vocal cord or vocal fold. This is the vocal fold that actually will vibrate to produce the sounds. So looking at those, I like to use this picture. Now this is a little bit complicated. It's a frontal section. We first like to point out some of the things that we already know. We see that this is the thyroid gland, glandular tissue on each side. There's kind of the base of the tongue. This is the epiglottis. So air will be traveling down through here when you inhale or up this way when you exhale. But I like to show this picture just to show you why these are known as folds. The vestibular fold, or false vocal folds, notice how it's folding out into the lumen. Its job is to close off the airway. So it doesn't vibrate, but it can completely seal off the respiratory tract. If you're holding your breath and you don't want air to enter or exit the respiratory tract, the vestibular folds will close off that airway. Whereas the true vocal folds, notice how they're folding out into the respiratory tract, are the ones that will actually vibrate to produce the sounds. So that's the only reason why I show this picture, just to show you why they named these folds, because they actually do fold out into the lumen of the respiratory tract. Looking down, as if you were using a scope to look down into the respiratory tract, we see again these folds, and notice that the true vocal folds will move in and out. So they will adduct and abduct. They will also tighten and loosen. And that tightening and loosening produces the different pitches that we have with our voice. This is an actual picture taken using a scope. And you'll notice that, well, this is the epiglottis. Notice right here is the epiglottis on the drawing. Back of the tongue would be here. So this is the epiglottis. Here and here are the vestibular folds. They're the more superior folds. And here we can see the true vocal cords or vocal folds located more inferior to the vestibular folds. And they're going to adduct and abduct in and out of the respiratory tract, tighten and loosen to produce different pitches. Next video, we'll move down into the lower respiratory tract. We already did the larynx, but we'll continue down the lower respiratory tract and look at the trachea and how it eventually forms what we call the bronchial tree. Because these airways are eventually going to branch and branch and branch into many, many small airways.